Колеги, розпочинаємо.
Colleagues, we are going to start our next briefing. The bloodshedding disability or bleeding disabilities in the world, it is hemophilia, which is a very dangerous disease, and it's very topical. Non-military topic. We are going to talk about that with Panel Tereshchenko, representative of the Minister of Health of Ukraine, Alexander Shmyl, chairman of the All Ukrainian Association of Hemophilia, Alexander Tkachenko, representative of the Committee of Mothers of Children with Hemophilia, Olena Shevchenko, head of the Health Control of Kyiv City Governmental and the leading child hemophilia disease doctor. So you have the floor. Good afternoon, dear representatives of mass media. Good afternoon, esteemed citizen, and those who can watch us in the live online. And I would like to also to welcome those who suffer from hemophilia. Before starting the briefing, we have to understand the problems behind this disease, hemophilia in adults and hemophilia in kids. So let's start with the statistical figures. What do we have today in Ukraine? What kind of situation? As of January 1, 2014, among those who suffer from hemophilia, among the adult persons, we are talking about 1,800 persons. Speaking about children, is 952 hemophilia A, hemophilia B, and Willy Brandt disease. Those who suffer from this disease are disabled persons who are recognized as such either from childhood or as disabled persons. Both adults and children are financed from the state budget. Over the last 3 years, the situation is not, let's say, stable and unchanged from year in, year out. The adults, we are talking about 68 million hryvnia. In the children, hemophilia for the prevention is 53 million hryvnia. So what the situation is today? We know that year in, year out, we purchase the bread factors. According to the region data, the residue, according to the factors 8, 9, 7, we have for 15 million hryvnia from 68 million, which were used for the procurement. Children hemophilia, out of 53 million, today the remaining part is 10 million hryvnia. So such a critical situation, which would demonstrate that we have an extremely bad situation. We cannot talk about that, actually. Out of the 5 regions, in 11 regions, the level of provision and the, let's say, the rest is quite big, and that means that we have to redistribute the available money from region to region. So this is a true information. We can provide any rep of the mass media or public organization this official information. Today's situation, speaking about the tender procedures, unfortunately, the anti-monopoly committee blocked completely. We're talking about the adult persons suffering from hemophilia, the medications by a farmer. In the children hemophilia, situation is maybe not perfect, but at least we have some progress here. What I'm talking, yesterday accepted were, according to the state procurement, to the tune of 13 million blood factors out of the 12 items which were actually awarded. 4 items were accepted, and we are going to sign the contracts with the winners in the tender. As for the remaining 8 items, unfortunately, the effect of the Minister of Health of Ukraine is not enough, it's not sufficient. Actually, we are talking about untrustworthy, or let's say some shortcomings in the documentation which are related to the state procurement. We are going to make it public. In over two items, regulatory preparations have been re-registered, and that's why the producers, in order for us to buy those medications at the expenses of the state budget, they have to re-register this preparation according to a specific resolution, which is valid since August 1, because we can procure only those medical preparations and medications which have been provided with the wholesale and retail prices. That's why we really expect registration on the part of those producing companies. The Minister of Health really realizes the complex nature of the situation. In June this year, we actually addressed all the economic entities in order for them to give a hand to provide assistance to Ukraine, especially if we are talking about procurement, different blood factors. Unfortunately, not a single representative of among the economic entities or producing companies did not heed to the request of the Minister of Health of Ukraine. Besides, the Minister of Health of Ukraine in July and August addressed the WHO, the Children's Foundation, UNICEF, all the international foundations which cooperate with the United Nations, also to give assistance or render assistance to Ukraine in procuring and purchasing the blood factors. Unfortunately, we have received no reply to our requests or addresses. In addition, those groups which actually determine the tender procedures, the range of the medications to be bought, they include the representatives of the public organizations. I believe that Alexander today is going to tell you about the cooperation which takes place in the Ministry of Health of Ukraine.
I'd like to thank, first of all who are involved in this, and also those patients who are tolerant to some steps in order to get preparations of blood, but it not always it depends on central bodies, on the ministry, and on political will. There is a political will, and information you received is true. It doesn't matter whatever somebody says, and we can officially give you evidence with our letters. Thank you. And invite Alexander Tkachenko is a representative of the Committee of Mothers of Children with Hemophilia. Good afternoon, dear lady chair. I would like to get more to give more emotions to this briefing. I would like to thank the Minister of Healthcare and on the State Department of Healthcare in Kiev that supported us and came with us. The first thing I would like to say that probably Kiev belongs to those problematic regions, difficult regions Alena mentioned, because our children who are sick with hemophilia of the different level, they don't get prophylaxis since June. That's maybe you have true data, but our children are without any state support since June. I speak about Kiev. There are some other mothers here, they can confirm. We don't have assistance, public assistance since June. Also, we have tolerance for many years because the situation with state procurements is very difficult, not for the first year. State procurements never happened at the beginning of the year. That's why by the end of the year, we have as if what is left of those preparations, but it's not what is left. It's just that the tender was not in February, but usually it's in the summer, or like now, in September of this year. As you understand, if there was a tender now, then by the end of the year we'll have, well, what will be left. But that is not what is left. That is what was saved on our children. So we don't have tolerance. We have bleeding, and we cannot fight any other ways but without assistance of state. All the medicine is important. I want the journalists to understand. That's why when we say that the tender will be held in September, we have to understand that that's sum of money in hryvnia is not changed. But we lost more than 60% of our budget because if the tender was in February, then that would be one volume of procurement, and in September and October it will be more than 60% we lost. That's why the situation for us is quite critical. Yes, there are some regions where the situation is better, and they held tenders this year, and they invested from local budget. But Kiev is under. It's a big problem in Kiev region and city. I would like to ask you to tell you it's not true that children are disabled. Yes, we are disabled. Uh, Allegedly, but children become quite full-fledged members of the society. They integrate completely. They can go to kindergartens and to schools, to universities, and they can work and they can pay taxes to the state and not to be a burden for anyone in the future. But every time when we stopped treatment, we add to the next ministers and to the next budget additional spendings to support disabled people in the future. I would like to invite the next speaker because we have very short time and the situation in Kiev is very difficult. Let's listen. I invite Olena Shevchenko, who's the chair of the health control of Kiev City Governmental Administration. Good afternoon. I would like to thank you all for that you raised this issue. Hemophilia of adults, of children, that is quite a sub issue in Kiev. You know that Kiev, together with the state, holds we procure this medicine, and that requires about 126 million for adults and for kids, and for children only about 12 million. This year, Kiev was in a very difficult situation on two things. First of all, the burden for our budget. The biggest sum of the budget was taken from the budget because of those events, unfortunately, since November until now. But also, we have more patients who have hemophilia who moved from Crimea or from the east, and that creates a problem. I would like to emphasize that the Ministry of Healthcare here, Kiev, we spoke to them, and after the tender, the quota for Kiev will be high to get that medicine for patients in Kiev. And that's first of all about children, and again because of financial problem. And a dad we have from the previous year. This year we had 3 tenders on the Department of Healthcare, which didn't happen 2 times, and we only had once. And it's because we had debts for previous years. That's true, but you understand, it's not a debt from our department. It's a debt because we did not receive money from the budget, and our debts were covered in Kiev. We announced a tender, and we hope that our children will receive medicine. I would like to emphasize that Natalia Kordakova will receive a floor, and our children are provided, and Willebrand disease also they are provided with medicine, but also we have a problem with children who need planned treatment of hemophilia, and I would like to thank parents because we were taught when adults are sick, it's one person is sick, and when a child is sick, all the family is sick, and when we unite our efforts, we will solve the problem. Believe me, every year since December, we sent proposals to tender procedures and to the ministry and also to our department in Kiev. This is, with God's help, we will handle the situation. Thank you very much. Let's listen to Natalia Korlakova, who's the main hematologist. I will speak Russian. Good afternoon. I would like to underline once again such a thesis that these children, disabled from childhood, they can live a normal life, and the only thing they require for that is adequate treatment, adequate support with medicine. In Kiev, it's a catastrophe for children who have hemophilia. We have medicine only for fast urgency, for emergency cases, just to support them if there is a threat to life. I don't have more. I cannot give to one child more and to the other less. So they're all sitting and waiting. In case something happens, unfortunately, only for emergency, we have medicine. Yes, this year we have enough of. We have new kids from other regions, and they live in Kiev now. Now we must provide specialized medical assistance to them, medical aid for them, because we have diagnostics which works for 2 years, and adequately we found heavy forms of hemophilia, and we have 17 people with that form in Kiev, and in 2010 we had only 3. So children become more heavy, and children that come from regions to Kiev. If we don't treat these children, then by 18 years old they will become real disabled in wheelchairs, and we would like to prevent that. Thank you very much. Listen to Alexander Shmilak, who is the head of the Society of Hemophilia. I have 3 minutes. Okay. First, I would like to thank representatives of mass media for the interest to this issue, because improvement of treatment of hemophilia, it's because of mass media. But we have to mention that fact, how a problem came up, and the problem is just is a problematic disease. We have it for 6 or 7 years. The major problem is that there is a lack of preparations, and preparations are used that can infect patients which HIV or hepatitis or hippos, and there are. It's not just a preparation. It's not just a threat to health of kids and adults. There is a threat to their life, because Ukraine is the only state in Europe where there is no minimal support for these patients. It's quite an issue. It's not a problem abroad, and there are examples like patients with heart form of hemophilia, and sportsman, bicycle sportsman, but he did not participate because he broke his hand. He participated not in Olympic Games, but for example, in Israel, there are 2 men who have hemophilia, but they are in the army, and for us, they become disabled in their early age. It's impossible to go to school for them. No. They cannot get a profession, they cannot find a job, and to start a family, it's completes a social adaptation. So at present, in regions, there are regions that don't have preparations, no medicine. In some regions they have, but that doesn't solve the problem in general. And we lost a lot of support, 60% from the previous year, and even last year. And it did not meet international standards, the support of the state. So we'll speak to the government, and we'll demand, it doesn't matter how, to finance better and to invest about 200 million. And the organization is working a lot with international partners and with the Ministry of Healthcare. Will receive humanitarian assistance, and will spread it through Ukraine. That doesn't solve the problem, but it will save somebody's life. How much do you need in the budget for planned and for emergent treatment of such children. For adults, 310 million a year, and for 100% of support for children, 256 million a year. The budget, draft budget, Ministry of Healthcare gave that they plan that sum in the budget for 2015, but that will depend. But for this year, they got 68 for adults, 53 for children, so from 100% of the need. And how much did you use? So tender so that money is not used, and it's almost in the end of the year. Questions? Information clarify that Biofarm blocked the tender. What do you mean? A tender. What kind of conflict is there? Why? Thank you for your question. It's not me who can give you an answer. Nobody can answer that question here because there is a statement of Biofarm Anti-Monopoly Committee on blocking the tender procedure for adults hemophilia. Biofarm preparation. I would like to say that recently they developed factor 8 to treat hemophilia patients, and that preparation was registered, but it doesn't meet many requirements under the Ministry of Healthcare and police. To confirm the quality and safety of the preparation, we did not receive the answer from them. So our request is in the general prosecution. Biofarm tender, they blocked because they don't need necessary doses, and which they have certificates. They can produce it, but somehow they don't have it. So they had to sell. They wanted to sell that dose on which they can provide, and on that base, they sent a request to the Anti-Monopoly Committee, and they blocked the whole tender for adults. At 2 o'clock, the Ministry of Healthcare, there will be a working group on hemophilia, and they will consider that issue. Questions? My son is a patient. I have a question to the Department of Kiev. In 2011, you received us, and you told that there would be a department in Kiev which would meet European standards. In many years, we have in the first clinical hospital number one, only several beds in the gastrological department. Give us an answer. How long will we wait? There was no war. We didn't have problems like we can now. What have our children to do? We have only one doctor in Kiev, a pediatrician who was trained for half a year. She has to work 24 hours a day, and we call her during daytime, during nighttime. The situation is the same for more than 3 years. Thank you very much for your question. I would like to clarify. In 2011, we didn't have no department, no beds for the patients with this disease, and we take steps for that. And now, in some somatic department, so we reform a hospital, and there are 3 doctors, hematologists, and I talent who were trained, who graduated, who took a course, and they received professional training. Plus, we have a main specialist who is near with us, who gives additional consultations. As to reality, as to 24 hours, you were in Kiev administration, and we were promised that there will be conditions that a doctor will be on duty in the first kids hospital, and not from today, but since December 1, if it will be. If there will be money for the salary, we will start that from October. Also, we discussed with you in 2011 that as to postponement of providing to patients supporting patients by the place of living. I would like to thank deputies, and we trained nurses, territorial nurses by dislocation, or people who have a difficult form of hemophilia, and we have a list and we have information, and every head of ambulatories, they have information about kids patients, and there's the stuff to help them. But to get a preparation by location, by the place where I live in, it was impossible. We're not able to develop a medication for us because we just don't have it. And I would like to add, when we speak about patients, a child patient 3 years for me it sounds wild for me because for 3 years they received a treatment and I understand them, but for many years they were treated in Ahmadiyya, but it was let's listen to one more mother. Nina Yurnievna, mother of the child, and we have Wilbrandt. You said we have 3 doctors, hematologists. I'm right there. Give me their names. I would like to meet them. I am there on a regular basis. I don't want you to see people who listen to you. I am there. I recently, because I was in the hospital, it was urgent, and there was no doctor. I don't speak about 3. There was no one. That and it was in the end of the day, and nobody could diagnose and the child. The low bleed, and all of that was done on the phone. Can you understand this situation when a child gets into a hospital with a trauma? If he had a wound on his head, can you you understand what can happen? There could be bleeding to the brain, and the doctor cannot be there for 20 hours, and then there is no one. You will not find 3 doctors there. I am there on a regular basis. They don't have 3 doctors there. Yes, the situation is very difficult. Give us this information clearly, because since July there were 2 more doctors were trained, and we gave them salary, and officially there are 3 doctors there. The only thing we will we'll investigate this situation. There could be. I understand this is not a justification for you, an excuse for you. We'll keep in touch with you, and maybe they have vacations, and let's hope they will start doing their job. Unfortunately, we don't have more time for questions. Thank you very much. You voiced out the problem for our media, and we'll wait for